Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previous year related most important questions. Part 1. Let's start. The first question. Position used while inserting NG tube is option A supine, option B high fallers, option C low fallers, option D orthopenic. The correct option is option B high fallers. Fast process in wound healing. Option A. Collagen fibril will form. Option B. Granulation tissue will appear. Option C. First intentional healing will take place. Option D. Neutrophils line the wound edge. The correct option is option D. Neutrophils line the wound edge. The nurse reviews a patient electrolyte results and notes that the potassium level is 5.4 MEq per liter, 5.4 mmol per liter. What should the nurse look for on the cardiac monitor as a result of the laboratory value? Option A. ST elevation. Option B. Peaked P waves. Option C. Prominent U waves. Option D. Narrow peaked T wave. The correct option is option D, narrow peaked T wave. Permanent abnormal dilation and destruction of bronchi and bronchiolitis is known as option A, emphysema, option B, asthma, option C, bronchiectasis, option D, atelectasis. The correct option is option C, bronchiectasis. The term applied for the fluid, cells, or other substances that are slowly discharged from cells or blood through small pores or break in cell membranes is option A. Exudate, option B. Pus, option C. Infiltrates, option D. Secretion. The correct option is option A. Exudate. A low residue diet contain all except option A. Roast beef, option B. Fresh peas, option C. Mashed potatoes, option D. Baked chicken. The correct option is option B. Fresh peas. A principle of ethical practice includes the respect and trustful behavior toward the clients known as option A. Veracity, option B. Accountability, option C. Justice, option D. Autonomy. The correct option is option A. Veracity. The nurse review the arterial blood gas ABG result of a client and note the following result: pH of 7.30, PaCO2 of 50 mm of Hg and bicarbonate ACO3 of 22 MEq per liter. The nurse analyzes this result as incidentating which condition? Option A. Metabolic acidosis compensated. Option B. Respiratory acidosis compensated. Option C. Respiratory acidosis uncompensated. Option D. None of the above. The correct option is option A. Metabolic acidosis compensated. Removal of non-visible tissue from an open wound to promote healing is known as option A. Debridement, option B. Cleansing, option C. Excision, option D. Dressing. The correct option is option A. Debridement. Which of the following is a substance that decreases pain transmission and cause an inflammatory response? Option A. Substance P, option B. Histamine, option C. Prostaglandin, option D. Endorphin. The correct option is option D. Endorphin. The cell organelle responsible for the formation of acrosome in a sperm is option A. Ribosome, option B. Mitochondria, option C. Golgi bodies, option D. Lysosome. The correct option is option C. Golgi bodies. The log roll turning method is used in option A. Lung abscesses, option B. CVA, option C. Spinal and cervical injury, option D. Epilepsy. The correct option is option C, spinal and cervical injury. The goal of phototherapy in a newborn is to option A, promote respiratory stability, option B, decrease the serum unconjugated bilirubin level, option C, decrease the serum conjugated bilirubin level, option D, prevent hypothermia. The correct option is option B, decrease the serum conjugated bilirubin level. Which one develops from endodome? Option A, nervous system, urinary bladder and eye. Option B, liver, connective tissues and heart. Option C, thymus, spinal cord and brain. Option D, liver, pancreas and thymus or thyroid. The correct option is option D, liver, pancreas and thymus or thyroid. Nurse found a patient collapsed during ward round. Which of the following is a priority nursing intervention? Option A, start oxygen. Option B, check pulse. Option C, start CPR. Option D, notify physician. The correct option is option B, check pulse. What will be the ratio of PRBC, platelets and FFP for massive blood transfusion? Option A, 1:1:1. Option B, 2:1:2. Option C, 1:2:1. Option D, 2:2:1. The correct option is option A, 1:1:1. Which of the following statements defines massive blood transfusion? Option A, replacement of greater than 10 volume in 24 hours. Option B, replacement of greater than 1 blood volume in 44 hours. Option C, transfusion of more than 10 units of PRBC in 1 hour. Option D, transfusion of more than 4 units in 1 hour. The correct option is option D, transfusion of more than 4 units in 1 hour. Which action by the nurse in charge is essential when cleaning the area around a Jackson pad wood drain? Option A, cleaning from the certain outward in a circular motion. Option B, cleaning from periphery towards central in circular motion. Option C, cleaning briefly around the site from left to right. Option D, cleaning briefly around the site from right to left. The correct option is option A, cleaning from the central outward in a circular motion. A patient is to receive 3000 ml of 0.9% NaCl IV in 24 hours. The intravenous rate delivers 15 drops per milliliter. The nurse should regulate the flow rate so that the patient receive how many drops of fluid per minute? Option A, 21. Option B, 28. Option C, 31. Option D, 42. The correct option is option C, 31. A client has just returned to a nursing unit after a cardiac catheterization performed using the femoral artery. The nurse places the client which position? Option A, bed rest with head elevation at 30 degree. Option B, bed rest with head elevation at 45 degree. Option C, bed rest with head elevation at 60 degree. Option D, bed rest with head elevation at 90 degree. The correct option is option A, bed rest with head elevation at 30 degree. Thank you for watching. Please like and subscribe.